HIV infection, symptoms and treatment. Acquired immunodeficiency syndrome is a potentially fatal illness brought on by an infection with the human immunodeficiency virus, HIV. HIV weakens the immune system, making the person susceptible to further infections. HIV attacks CD4 cells in particular. Generally speaking, these cells help the immune system fight off infections. Within a few weeks after being infected with HIV, early positive signs may become apparent. Symptoms of HIV infection. Different symptoms are associated with each stage of HIV's progression. Here's the detail. Indicators of an early HIV infection. Within 24 weeks after infection, the first symptoms of HIV might be seen. It may take a few weeks for these early HIV positive symptoms to fade. Some examples are as follows. Fever rash, aches and pains in the muscles, bones and brain, lymph node swelling, inflamed throat. HIV manifestations in the clinical latency period. Following the acute phase of HIV infection is the clinical latency period. Chronic HIV infection is another name for this period. At this point in the infection process, there may not be any noticeable symptoms or they may be very minor. This phase may continue for a decade or more for persons who do not get treatment for their HIV infection. However, this second stage might extend for decades for people actively seeking therapy. In this chronic HIV infection stage, some of the minor symptoms include fever, diarrhea, fatigue, slimming down, different fungal or viral infections. HIV symptoms in the end stages. The terminal stage of the illness is reached within a decade or so if treatment is not initiated. During this last phase, AIDS manifests itself. AIDS-related symptoms caused by HIV include recurrent fever, sweat during sleep, slimming down, constant loose stools, rash, constant exhaustion, having mouth ulcers, lymph node swelling that does not go away, pneumonia, memory loss and depression. HIV treatment. HIV therapy should start as soon as positive test result is received. If you see any early HIV symptoms, you should see a doctor immediately and be tested. HIV may be treated with a wide variety of drugs. HIV therapy medications all approach the virus from various angles. The typical prescription includes 23 different medicines. Here is a precaution that may be taken to forestall the spread of virus that have developed resistance to a particular class of antiviral drugs. HIV treatment has to start as soon as possible. If your CD4 count is below 350, you are pregnant, you are on a medication for an illness like hepatitis, or your symptoms are severe, getting tested is essential. After determining a patient's CD4 level, doctors may develop a treatment strategy for HIV. HIV therapy aims to suppress viral replication in the host. Individuals' treatment plans might vary by their current health status and the progression of their HIV infection.